Sexually transmitted infections, commonly referred to as STIs, are infections that are primarily passed from one person to another through sexual contact. These can be caused by bacteria, viruses, or parasites, and they affect millions of people worldwide every year. Understanding what STIs are, how they spread, their potential impact, and most importantly, how to prevent them, is vital for maintaining your sexual health and overall well-being. STIs come in many forms. Some of the most common include chlamydia, gonorrhea, syphilis, human immunodeficiency virus, or HIV, herpes simplex virus, human papillomavirus, or HPV, and trichomoniasis. Each of these infections has unique symptoms, treatments, and implications, but they all share one thing in common: they can be transmitted through sexual activity. This includes vaginal, anal, and oral sex, and in some cases, even through skin-to-skin contact. It is a common misconception that you can always tell if someone has an STI. In reality, many STIs can be present in the body without causing any noticeable symptoms, sometimes for years. This means that a person can transmit an infection to their partner without even knowing they are infected themselves. Because of this, regular testing is an essential part of sexual health, especially if you are sexually active with new or multiple partners. STIs can have serious health consequences if left untreated. For example, untreated chlamydia or gonorrhea can lead to pelvic inflammatory disease in women, which can cause chronic pain or even infertility. Syphilis, if not treated, can damage the heart, brain, and other organs. HIV attacks the immune system, leaving the body vulnerable to other infections and diseases. Some strains of HPV can cause cervical cancer or other cancers. Even infections that may seem mild, like herpes or trichomoniasis, can cause discomfort, stress, and complications in pregnancy. Prevention is the most effective way to protect yourself and your partners from STIs. There are several strategies you can use to reduce your risk. The first and most reliable method is abstinence. Choosing not to have sex eliminates the risk of sexually transmitted infections. However, for those who are sexually active, there are many practical steps to dramatically lower the risk of transmission. One of the most important preventive measures is the consistent and correct use of condoms. Condoms act as a barrier, preventing the exchange of bodily fluids that can carry infections. Male condoms, female condoms, and dental dams can all provide protection during different types of sex. Remember, condoms are most effective when they are used from the beginning to the end of every sexual encounter, and when they are used every single time. Another key step is open communication with sexual partners. Talk honestly about your sexual history, STI testing, and any concerns you might have. Mutual trust and transparency can help ensure that both you and your partner are making informed decisions about your sexual health. It's also important to agree on using protection and getting tested together. Regular testing is especially important if you have multiple partners or if you are entering a new sexual relationship. Vaccinations can also play a critical role in STI prevention. The HPV vaccine protects against the types of human papillomavirus that most often cause cervical and other types of cancer. The hepatitis B vaccine is another important preventive tool, as hepatitis B is a sexually transmitted virus that can lead to serious liver disease. Check with your healthcare provider to make sure your vaccinations are up to date. Limiting your number of sexual partners can also reduce your risk. The fewer partners you have, the lower your chances of encountering an infection. Being in a mutually monogamous relationship, where both partners have been tested and are only having sex with each other, can further decrease your risk of STIs. Personal hygiene is another aspect of STI prevention. Washing the genital area before and after sex can help reduce the risk of infection. However, it's important to avoid douching, as this can actually increase the risk of some infections by disrupting the natural balance of bacteria in the vagina. If you are concerned that you may have been exposed to an STI, or if you are experiencing symptoms such as unusual discharge, sores, pain during urination, or rashes, it is crucial to seek medical attention promptly. Early diagnosis and treatment can prevent complications and reduce the likelihood of transmitting the infection to others. Many bacterial STIs, such as chlamydia, gonorrhea, and syphilis, can be cured with antibiotics. While viral infections like HIV and herpes cannot be cured, they can be managed with medication to reduce symptoms and lower the risk of transmission. Remember that testing is confidential, and there are many clinics and healthcare providers who can offer support, information, and treatment. Taking charge of your sexual health is a sign of responsibility and self-respect, not something to be ashamed of. It's also important to recognize that STIs do not discriminate. They can affect anyone, regardless of age, gender, sexual orientation, or relationship status. Education, awareness, and open dialogue are key to breaking the stigma surrounding STIs and to fostering a culture where people feel comfortable seeking help and talking about their health. In summary, sexually transmitted infections are common, but they are also preventable. By practicing safer sex, getting regular checkups and tests, communicating openly with partners, and staying informed about vaccinations, you can protect yourself and those you care about. If you ever have questions or concerns about STIs, don't hesitate to reach out to a healthcare professional. They are there to help you make the best choices for your health. Taking the time to learn about STIs and how to prevent them is an investment in your future health and happiness. By making informed decisions, you are not only protecting yourself, but also contributing to the well-being of your community. No matter where you are in your journey, remember that knowledge, prevention, and compassion are your best tools in the fight against sexually transmitted infections.